Okay, so I'm going to get started now. Just so that you guys know, I am going to record the dissection, but your names and like pictures and whatnot are not going to pop up at all. It's just so that people that aren't able to make it are able to watch it from home. So I mentioned earlier, if you do want to follow along, I'm pretty much following the lab number 8, which I just posted a link on Google Classroom yesterday for. So some of this stuff I have already started prepping just because I'm only allowed to stay here until 11. So I wanted to make sure I could show you the really cool stuff. So a couple of these incisions that are shown on the first page in part A, I've already started to do some of those, so I'll point those out as we're going through. And then if there's anything where you want me to pause or you want to see something more closely, just let me know by typing it into the chat. And I will sort of pause and explain it a little bit further. So starting from just the outside before I show you guys the incisions. This is our fetal pig that we're going to be dissecting. This is a male, so we can see it has the scrotum down here. Yeah, so we're going to be taking a look. We're going to really focus on just the 3 systems that we're learning about in our class, but if there's something that sparks your interest, just let me know, and we can kind of go over that as we go. Okay, so on the first page, you'll notice that there's some instructions about tying the pig down. And so I'll just show you what I've done. I've just tied around sort of the wrists and around the ankles. And basically the reason I do that is I want to be able to really open the pig up and then start pinning it down. So I've just got to tighten these a little bit, but as I said, I started making a couple incisions just in preparation because it's a little bit hard to do this by yourself. Usually you'd have like 2 or 3 people helping out trying to get it pinned down. So I'm just going to open it up like this. And I'll show you guys how I did the incisions in just a few minutes. You can see some of them are outlined already on your on the lab sheet, which I shared with you. So again, I sort of had to get that started just because it's a little bit hard to do as one person. I know this is not a super exciting part, but sort of necessary. Okay, so we've just got our pig tied up now, and I just want to show you that I've made a couple of incisions just to help me actually get it opened up. So I'm sure in grade 10 science you use the scalpel as well. I always say that the scalpel is meant to cut through skin, so it's obviously very sharp. And what I've done is just cut really along those lines that I mentioned. I'm going to just show the one cut I didn't do yet. So this here is the umbilical cord. It's sort of dried out a little bit if you can see it from there. So I'm just going to cut on either side of that. And just like in grade 10, I don't want to really saw away at this too much. I want to just go pretty gently actually because I don't want to damage anything that's underneath. So I'm just cutting on either side of the umbilical cord. And as I mentioned, the umbilical cord, we're not studying that as an organ, so we're not really going to talk much about that, but that's just to kind of get a little bit of a head start. And I'll just point something out. I'm going to raise up the pig for a quick second here. You may or may not know, but the umbilical cord has the really important job in utero, so before the pig is born, to essentially feed the pig with nutrients from the mother. It's the same thing that would happen with other mammals. So you can see this little thin piece that I'm just tugging at right now looks like sort of a thin cord. That piece is actually filled with really important veins that are going into the pig. So even when I look at the other side, I can see that there's quite a bit of tissue right here, which is just to the other side of the umbilical cord, right? That's helping to actually feed the fetal pig while it's in utero. So I'm going to drop this down for a quick sec. As I mentioned before, we're following along in lab number 8. So I've essentially done the first page for you because it's not super exciting, but I'll flip to the second page. And you're going to see that we're going to start exploring the oral cavity, the mouth. So I mentioned right there, we're going to make an incision at each corner of the mouth. And I'm just really quickly going to change my scalpel because this one is quite dull. And I will pin everything down in just a few minutes. So as you see with the instructions there, we're going to just make an incision around the mouth. And you can see from the picture, our goal is actually sort of to break the jaw because we want to be able to like look down right inside of there. So obviously, just like with other mammals, the jaw is pretty tightly shut. If you could feel in the mouth, there are already teeth in there. So if I were to press too hard in the mouth with my glove, it would definitely puncture the glove. And it could even puncture my skin. So that wouldn't be good. So as I said in the instructions, we're basically cutting back from the mouth. So think of like the Joker. We're basically doing that on the pig. So I'm going to just turn it around and do that slightly on the other side. And the next part is sometimes a little bit difficult to watch, which is that we do need to break the jaw. So the reason that we have to do that is that we want to try to see inside at the back of the throat. We want to try to see the epiglottis if we possibly can, as well as sort of the opening to the trachea. So I'm just like really gently just cutting back here just to open the skin parts. And I will show you guys if you want to see the teeth. So I'm going to just raise it up. You can see there's teeth and a tongue inside of there, right? So that little shiny thing that you see, those are the teeth at the bottom. So we're just being gentle around that. And so now I do actually need to break the jaw. Okay, and you can kind of hear that happening. Now, there is a little bit of fluid in here. I'm just going to pour the fluid out. I do get the question a lot, what is that fluid? It's not formaldehyde. It's something that the company makes just to preserve them so that they don't start to decay on us. So I'm just going to pour that out a little bit. And what I'm looking for is to go right to the back and just basically seeing where the tongue ends, and hopefully we can see the epiglottis. So I'm just going to push the tongue back a little bit more and just see if we can see it. And some of this stuff on the side, we're going through like muscles here. We're not actually going through the jawbone on the sides here right now. Okay. And hopefully you guys are able to see when I really pull back on it, there is a little tube back here. Okay. Now the tube that I'm pointing out right now is really soft and flexible. So that tells me that this tube is actually the esophagus right back here. I'm going to just get my probe quickly to show you guys a bit better. It's difficult because I don't want to touch my phone with my gloves, but right at the back here, we see like a really soft and flexible tube, and that tube is going to be our esophagus. Of course, at the back of the throat, we're also going to find the trachea. We haven't really started on the respiratory system yet, but the trachea is the windpipe. You might have remembered that from last year. Also, just in the mouth while we're here, you can see what's called the hard palate. And it's sort of a bumpy sort of surface. So even in your own mouth, if you feel with the top of your throat, the top of your tongue, the top of your mouth with your tongue, you're going to feel it's really, really bumpy. Okay. So the pig has the exact same thing again here, very similar to human anatomy. So that's basically the oral cavity. Do you guys have any questions about oral cavity before we go on? Okay. So the next part we're going to do is we want to look at the abdomen. I'm just going to fix my ties a little bit here so we can really look around inside. And I have started to cut it, like I mentioned before, only because it's kind of hard to do it on your own. So I just wanted to make sure I could actually get it open for you guys. So now we're looking in the abdomen. So I just want to point out right now, I actually have not cut through the rib cage. That was intentional because I wanted you guys to be able to see that part. I'm going to actually start by cutting through that, and I'm going to use a small pair of scissors for that. Rib cage, again, just like us, has bones and muscles in it. So I want to kind of get that open just so we can take a good look inside of it and kind of open up the cavity. Okay, and I'm gonna just gently cut around here because this is actually the diaphragm, which we're gonna point out in a few minutes. So I wanna be able to see that. So I'm just opening it up nicely. So at this point, usually in class, we would start to actually pin it down, but I'm gonna actually wait a few minutes to do that. So you can see if you're following in our lab document that I posted, the first thing that we're looking for is the liver. So some of you who have been following along, you're gonna know that the liver is this big, huge organ right here. Okay, so I'm gonna actually just tilt it up slightly, and hopefully what you can see is there's lots of different what we call lobes. Okay. And so if I take out the liver, I'm going to see that there's 4 separate lobes, and I will take it out and show you, but the liver is really quite large. Okay. And so the liver is just underneath the diaphragm. Again, diaphragm is an example of a respiratory system organ, but we still see it in here. So what I'm going to do is actually take out the liver. I know it says there to use the probe to find the gallbladder, but just for our sort of activity, it's going to be really hard to do that unless and show you unless I just take it out. So I'm going to just use my scalpel again here and remove the liver so I can show you a bit better. You guys know, hopefully from the lessons we've just done, the relationship between the liver and gallbladder is that the liver produces bile and the gallbladder is like a storage organ. So it's going to store the bile. Okay. So I mentioned it before, we have all these 4 lobes, and so I want to just show you with the camera. So basically, it's like 4 separate little areas, so to speak. So when I look at the bottom of the liver, I'm going to see only faintly, so hopefully you guys can actually see it in the video, but there's a faint discoloration right here, and it's actually looks kind of like a deflated balloon is how I would describe it. And this deflated balloon where my probe is sitting right now, that is the gallbladder. Okay, so again, if you're following along with the notes, you're going to know the gallbladder's whole job is just to store bile. Okay, now importance of that is that the bile is going to be released into the small intestine. So right here we see like almost this little it's very thin tube. So this is what we call a bile duct. And so the duct is going to lead directly into the small intestine. That's this little guy here. And again, the goal, if you're following along, is that anytime we need to digest fats, we're going to have a series of hormones that help with this, but then we're going to have bile actually released. Okay. Are there any questions at this time just about the liver before we go on? Okay, so if there's no questions about that, we're going to then look the next step, or step number 11, if you're following there. It's asking us to now locate the stomach. And it's saying lift the liver. I've just removed the liver because I want to be able to show you guys up close. But it says identify the J-shaped stomach. So if we go all the way to the back, and I'm going to actually lift the pig to show you, there's this sort of like sac back here. Again, kind of looks like a deflated balloon. And this sac is the stomach. So right now, there's actually nothing in the stomach, right? It's fairly empty because this pig hasn't been eating. But right here, hopefully you can see here, we have sort of this deflated balloon looking thing. I'm just going to point it out here. Right here, I'm sort of moving it around. So it looks like kind of a deflated balloon. Okay, now I am going to remove the stomach also just so that you guys can actually get a proper look, because I realize on the camera it's hard to see and you can't really zoom in and out too well. So I'm going to remove it and just show it to you that way. Just want to make sure I don't cut the spleen by accident, which is also right nearby. And hopefully you guys, if you saw in the notes, the stomach is connected on one side to the esophagus and on one side to the small intestine. So the tubes that we're cutting on either side of the stomach right now, that's representing those two tubes. So here is the stomach now removed, and hopefully we see it's kind of the J-shaped pattern I was mentioning before. So it kind of looks like a J when I go like this. That's why we describe it as J-shaped. Again, you can see right here, this opening goes into the esophagus. So this would be what we call the cardiac sphincter. And at the bottom of the stomach, sorry, there's a bunch of goo on here. One sec. At the bottom of the stomach, which is right here, there is another opening, which we call pyloric sphincter. That leads into the small intestine. Okay. So again, we're just at this point just checking it out. Okay. And it says to start removing them, which we've already done in step 11. And then it's saying to locate the pancreas. The pancreas is really quite small, so it's going to be hard for me to actually show it here, but I'm going to try my best. Pancreas, if you guys are aware, is one of its jobs is to produce insulin for glucose uptake in our bodies. So really important organ, which is sort of part of the digestive system, but also part of the endocrine system, which we learn about in grade 12. So right at the back, I'm going to raise this up to show you guys. It's a really small organ, which might make you think it's not that significant, but actually it's super, super important. We have the pancreas. And in grade 12, we actually do a whole unit just on something called the endocrine system. So if you do decide to take grade 12 bio, we'll talk more about the pancreas there. So I'm going to try to raise this up. Hopefully we can see it. It's a very small organ. So again, kind of hard to see with the videoing, but we're going to do our best. So it's right back here where my probe is touching. So it's really behind the liver and the stomach. And it's right beside something called the spleen. The spleen is, again, going to look right now like sort of a deflated balloon. Spleen, if you guys know, is really important for clearing and recycling red blood cells out of the system. So red blood cells, once they're kind of finished, they are going to go back to the spleen and be recycled. So again, really important organs, a little difficult to see just because they're at the back, but hopefully we got kind of a picture of it. So the next thing is really the intestines. So that's this big, huge mass right here. So usually in the lab, what we would do, and I'm just going to demonstrate it for you, is we want to start to actually remove this whole intestine. So I'm going to do that for you here. And I have a bit of a thick tissue I'm going to use my scissors for, actually. And again, following along with the notes, you guys will know the small intestine is very long but very narrow. Okay, the large intestine is very short but very fat, or has a large diameter. So this whole big mass that I'm holding right here, this is really, for the most part, the small intestine. I know it looks kind of like a brain. I'm going to just bring it a little closer to my phone just to show you guys what's going on. You can see that there's a tube that goes sort of along the top here where my finger is moving around. In here is what we call connective tissue or mesentery. And so what basically happens is that this mesentery is just helping to pack the small intestines down. Because if you remember from the notes, I said that sometimes the small intestines are like 3 meters plus in length. So they can be really, really long. So in the lab, what we would usually do, which I'm not going to do fully right here, just because it would take me a really long time to do, is we actually would cut through some of this mesentery. and we'd start to actually see that how long the tube really is. So there I've just made one little cut, and I can start stretching it out into a really long tube. So usually in the lab, what we would do is actually measure this out. And sometimes when we measure it, even on this small little pig, sometimes it's something like over a meter in length, right? So I would just continue really gently stretching and stretching and stretching. So that's a really, really long small intestine, especially considering that this guy's really small. Okay. So I would continue to actually unwind the whole thing, which I'm not going to do right now. But just want to ask you guys, does anyone know why does the small intestine need to be so long? Any ideas? So, if we think about what the functions of the small intestine are, it's really two things: digestion and absorption. So, we have a lot of like final digestion of things, which has started elsewhere in the body. But really, the end of digestion is in the small intestine. So in the duodenum, we're still adding lots of those digestive enzymes. We're continuing to break stuff down that has been either partially broken down or just not accessible until that point. And so the first sort of section, the duodenum after the stomach, that's really the goal. With the remainder of like still several meters of the small intestine, the job is absorption, right? So just making sure the body is pulling in all those nutrients we've just broken down, and really not letting them go to waste. So that's kind of the goal, and that's the reason this guy is so long. So I'm not going to unwind the whole thing, but hopefully you're getting an idea just from my little few incisions there. It's really long. Like I said, usually in the pigs it's around a meter in length. In us, it's way longer, like around 3 meters, because we're a lot bigger, obviously, but really long organ. I also mentioned they're measuring the large intestine, and I'm just going to show you guys just for sake of comparison. I mentioned before large intestine is super short but very wide. So that's where we get the term from. So I'm just going to show you a small section right here. Again, I'm not going to take apart the whole thing just because it will take a really long time for one person to do. But if you notice right here, we've got this really wide tube. This guy is usually only like maybe a tenth of the size. So if the whole small intestine is like 1 meter, you might get that this is maybe about 15 centimeters or so. So it's a very different length, right? If we look at the ratios for that. Okay. Does anyone have any questions about small and large intestine before we go on? Okay, so far so good. So we're going to move on to the thoracic cavity, which is really just the chest cavity. You're going to hear or you're going to see in the notes, we use those two interchangeably, thoracic cavity or chest cavity. So as I said before, I've started opening this up, which required me actually to cut through the ribs. I do need to use the scissors for this because just like for us, the rib cage is made of bones, of course, rib bones, but it's also got muscle in it. So it's very thick. So I won't be able to use the scalpel for this section. So I'm going to just cut it back a little bit so that you guys can get a sense for what I'm looking at here. And I need to use my probe for a second. So I just want to mention quickly, actually, before I open any further, a cavity means that it's something closed off. So what it's closed off by before the dissection is down here, a elastic muscle, which is called the diaphragm, which I mentioned before. When we get to the notes about this section, you guys will be doing some reading about the thoracic cavity. It's super important actually that it remains sealed off because that's really what allows us to breathe. So without that having been sealed off in real life, you would actually not be able to inhale and exhale without that. So it's really important that it remains that way. I'm just going to cut this back a little so we can see. Hopefully you guys are getting a picture already. There's the heart right in the center here, and I will actually take that out and show you guys afterward. Just want to cut this back a tiny bit more so you get a sense for what I'm looking at. Okay, so again, it says there to expose the rib cage and then to cut through it. It says describe the intercostal muscles of the ribs. So the intercostal muscles, like I mentioned, it's the muscles that are in between each of the rib muscles, rib bones. So what I'm feeling right now is I feel sort of the hard parts of the bones, but in between that, it's not just emptiness. In between the bones, we have muscle. So those of you who have ever had like ribs to eat before, you think about the ribs themselves, the actual bones, and covering up all of that stuff, that's all muscle tissue. And those are what's called the intercostal muscles. They're actually essential to help us breathe. So again, we're going to be looking a bit more of that next week, but this is just used as an intro. Okay. The diaphragm, again, is down here, and I've put in the instructions. We're going to use the scalpel to just really, really lightly remove it from the side wall. And the diaphragm is sort of like, again, just a really thin layer of tissue. I'm going to just cut it back a little bit just to show what it looks like. And I'm going to cut it out actually so I can raise it to the camera. It's very, very thin. And its goal is actually moving up and down to help you breathe. So when you take a really deep breath, if you're touching your stomach, you're going to feel your diaphragm moving up and down. So just to give you a sense, here is like a really thin piece. This is part of the diaphragm, and it's not skin, it's actually muscle, okay? You might remember from last year, for muscles, their whole job is to contract. So you can see it's really, really thin. It's really flexible. It has like elasticity to it. And when we breathe, it's going to move up and down. And it's basically going to be changing the size of this whole chest cavity. Okay, so more about that will come next week. The next part that we see is really the heart. Okay, so we've got heart and lungs here. So the heart is right in the center. And I am going to actually take out the heart just to show you guys a little bit better picture of it. And I mentioned this before, but just to reiterate, this is really similar to what the human system is because we're both mammals. Obviously, this is way smaller just because it's a very much smaller organism than us, but same idea. And I'm just trying not to actually destroy anything. I am cutting through some blood vessels. If you've studied the heart at all in healthcare, or if you've remember from grade 10 a little bit, the vessels I'm really cutting through at this point are the vena cava, which leads into the heart from the body, as well as the aorta. So I'm just cutting those so that I can actually get the heart out. And the heart is surrounded by something that we call the, oops. One sec. Sorry, guys. My scalpel seems like it's not very sharp. Okay, here we go. So we have the heart here. So a couple of things I'll just point out before we're going to actually cut it open and look inside. The human and the pig heart are what we call 4 chambers. So I'm going to just hold it like this. This is like looking straight on. And this one is actually really nicely colored because we have 2 chambers up the top, which are kind of obvious. These 2, which look darker, these are the atria. So the left and right atria, this is where blood first enters the heart from wherever it's come from. So whether that be the rest of the body or from the lungs. Down here, we have the ventricles. So here we have the right ventricle. You can see it's very much smaller. This is going to simply pump blood over to the lungs, which is not too far away. And then here, the left ventricle. Left ventricle, you might know, it needs to be really thick muscle because its job is actually to push blood all the way through the rest of the system. So that's the idea of the heart. Now, before I cut it further, I just want to show you at the top, hopefully we can get a good image, these big holes, okay? These are blood vessels that are coming to and from the heart. So the really big opening here, that is a really important artery called the aorta. Okay, aorta and these other ones are also leading out. So these are all what we call arteries because they are going away from the heart. So again, they are really important. If you have blockages in those, again, really, really bad, you're going to stop circulation. So what I'd also like to just do quickly here is to make an incision through the heart. So I mentioned in the notes, and I think it's number, let me see here, number 23. We're going to just cut through the heart here. I'm going to put it down just to be a little bit more safe. And we're going to check out what the inside chambers look like. And again, this is just an intro. You guys will get all the info in the notes next week, but just to show you, and you might have seen it in healthcare as well. I really just want to show you the thickness of the left ventricle. That's my goal here. Okay, so here's like our cross section of the heart. So oftentimes when you see like pictures of the heart, it's like it looks hollow. Obviously, while you're actually while your heart is beating, it's going to have blood in it most of the time in either of the chambers on each side. But just want to point out this ventricle right here. It's got a super, super thick wall. This wall is muscle. It's what we call cardiac muscle, and or sometimes you might see it myogenic muscle, and it beats on a very coordinated pattern. So essentially, the muscles in the heart, they're all special muscles. They've evolved to basically be controlled simply by the heart itself. So even if someone is, let's say, paralyzed, for example, the heart is still able to beat because it doesn't really need the connection to the brain. It has its own circuitry to kind of run things. In the lessons next week, you're going to see sometimes that goes wrong too, where the circuitry in here becomes damaged. Those people where that has become damaged, they might need a pacemaker input or inserted. So that is basically to keep the heart beating at a regulated pace. Any questions about the heart so far before we go on? Sorry, Barman, I don't understand your question. Oh, yeah, the left ventricle pushes it all the way around the body. So it's the source of the pushing basically that goes everywhere except for the lungs. The lungs has their own circuitry, which is coming from actually the right ventricle. So left ventricle has to be able to push really hard. It basically allows the blood in the whole system to be circulated, then back to the heart again. So many thousands of kilometers actually is the distance if you actually laid out all of our blood vessels. So it actually it's able to pump it all the way through that circuitry. Okay, so I'm going to go on then to the next little section here. looking at the trachea and the lungs. So I'm going to just hold this open again for you. I know it's going to be hard to see a little bit. I'll hold it up in just a second. The lungs are along the side here. So you can see what I'm touching on this side is the right lung, and then on this side is the left lung. So they're kind of right up against the rib cage here, and I'm going to hold this up to show you. I just want to eliminate some of that extra tissue that's in the way here. And our goal, which I'm hoping we're able to see, it might be really hard. Again, we tried looking at the esophagus. It's sometimes difficult on the camera because we can't zoom in the same way we'd like to. But here are the lungs. So I'm sort of holding them like left and right. So you can see there's sort of a pocket in the middle of the lungs where the heart had just fit into and has just come from. Again, I was just saying with the question from Berman is that there is a circuitry that takes blood directly from heart to lungs because that's where it picks up actually oxygen. I am going to remove the lungs just to give us a closer peek and just allow us maybe to even see the trachea, hopefully. I might have to use the scissors a little here. Just to cut things back a little bit. Again, with doing it in class might be a little bit easier just because you have more than one person able to actually hold things open. Okay, so here is, again, just a picture of the lung. So I'm going to show it from the front view because I think that's mostly how most of us actually recognize it. So we have left and right lung again. What we see at the top, which I know there's a lot of additional tissue, so I'm just going to try to clear it out here. There is an opening that leads into both of the lungs. So hopefully we can see this little opening here. This is the trachea. Also known as the windpipe. And when I touch this, it feels like very flexible, but it also has a rigidity to it. And so this tube is actually made of cartilage as opposed to made of muscle like the esophagus was made. So if you think of like how your nose is like a very flexible bone, okay. Part of why our noses and our trachea are made of cartilage, flexible bone, rather than something else, is flexibility. And so when I, for example, am sleeping on my side, this is not going to become totally crushed. And also my nose shouldn't be totally crushed so that I'm still able to get air into the body. Okay, so that is essentially the lungs. Any questions about the lungs before I go to look for the trachea? Okay, good so far. So I'm just going to open up again. Now this part, it's we're going to have to cut in a little bit more because as I said before, it's our trachea is like behind a bunch of stuff, and I do see that it's right there. So I'm going to try to minimize the amount of cutting just out of respect for the animal. But I do have to open it a bit further on the skin side just to show you. Specifically to show you the larynx or the voice box. And the pig's skin and muscle are quite thick here, which is why it's taking me quite a few passes to actually get it opened up. Okay. Berman, is that why are there two lungs? Yeah, it's just for efficiency. So our bodies need actually a ton of oxygen. And so to accommodate that, having two lungs is better than one. Of course, there are some people that, for example, there's disease and so forth, it needs to be removed. Those people will usually have to be on an oxygen tank because their body is not going to get enough supply of oxygen just from the one lung that they have. The same thing you'll notice too, if you look elsewhere in the body, like for example, the kidneys. The kidneys are responsible for filtering essentially waste from our blood. And so that job is extremely demanding because the blood is constantly circulating through there. So again, we can survive with one, but often those people will need something called dialysis because their body just cannot effectively actually circulate everything on its own. Yeah, and I always think of it back to like the evolution concept too, is when things are advantageous, they will stick around in a population. So the same thing is true here, where it's possible, like for example, there's some organisms have a totally different flow. They have no lungs at all. But the nice thing about the lungs is they allow us to do gas exchange inside of the body so that we're not depending on being in water. So we've evolved that trait. Okay, I think I've got this back far enough. We can now see it a little bit better. So what I'm touching right here, and I'm going to raise it up so you guys can get a better look. What I'm touching right here is actually the pharynx, excuse me, not pharynx, the voice box. I keep saying crazy words, sorry. So what I'm looking at here is essentially when you touch your throat, when you're talking, you can feel something kind of like vibrating. That's our voice box or our larynx. So pharynx is actually just a fancy name for the throat. So don't worry about pharynx too much. But I want to just zoom in for you guys. So it looks quite big. It's not the same thing as an Adam's apple, though they are very close to each other. But this big piece right here, this has the vocal cords inside. So vocal cords are when we're talking, essentially we're controlling our exhale, allowing it to actually move across these vocal cords. I'm going to lift this up just slightly more so you guys can see. So this really thick part right here, it's also surrounded by cartilage, that soft flexible bone. And if you notice, it leads into this tube down below. And I'm touching it here just to show you guys again. It's that same flexible trachea that I was mentioning just earlier. So if I push in on it, it closes, but it also remains slightly open. That makes sure that we're not going to suffocate. Okay, so essentially that is the dissection that we would typically do. Does anyone want to see anything else that I have not shown here before I start to tidy everything up? Okay, well, if there are no more questions, I will just thank you guys for joining in with the dissection. I am going to post the video, so if you did want to like go back and check it out, you're more than welcome to do that. I know it's not the same thing as doing the dissection in class, but hopefully we can use this as a bit of an intro. Obviously, digestive system we've sort of already studied, but we can use this as a bit of an intro or even as review for the other systems that we're about to study as well. Okay. So on that note, guys, I'm going to start actually cleaning all of this stuff up. Like I said, if you do think of any questions or whatnot, please just leave them in the comments. But you're welcome to go at any time if you feel your questions have been answered.